Is it dengue or is it COVID-19? That's the burning question in front of a lot of people facing high-grade fever, headaches, body aches, muscle aches. And that's the topic for today's discussion: how to differentiate between COVID-19 and dengue. Friends, this is Dr. Sitesh Roy, your allergist, immunologist and asthma specialist, coming to you with this special on differentiating COVID-19 and dengue. Dengue, or dengue as it is called, is caused by a virus that's a mosquito-borne viral vector. This virus belongs to the family called Flaviviridae, and it is known to cause infections up to around 400 million cases around the world every year. On the other hand, COVID-19, caused by the novel coronavirus found in 2019, is caused by a virus belonging to the beta coronaviridae family, and this virus is largely transmitted through respiratory droplets and also through airborne transmission, mostly in closed indoor spaces. In both of these viruses, which are positive sense RNA viruses, there are some very specific features which make them seem like they would overlap in terms of the infection presentation, but they are still very different infections and viruses. We know that dengue causes about 25 to 30,000 deaths around the world every year. However, we also know that COVID-19 has taken about 4.7 million lives since the pandemic began in January of 2020. So friends, let's know what are the differences in the presentation, in the treatment, management and the nature of these viruses in the next few minutes. So let's talk about some similarities first. When we look at the dengue virus, there are 4 variants that we know: DENV 1, 2, 3, 4. Similarly, when we look at COVID-19, there are 4 major variants: the alpha, beta, gamma and delta. Interestingly, the DENV2 variant, which is now spreading across at least 11 states in India, causes a more severe and a more rapidly evolving infection and can sometimes end up with the dengue hemorrhagic fever or dengue shock. Similarly, we know that the Delta variant of COVID-19 has been now sweeping across 185 countries of the world and has become the predominant variant of COVID-19 that is causing infections even in people who've been vaccinated. Similarly, though we don't have a universal vaccine for dengue, we have something called Dengvaxia, which is very selectively used. Dengvaxia, which is not a universal vaccine, has certain limitations because a person who gets infected with one variant of dengue can still get infected by the other variants beyond 3 to 4 months. Similarly, we know that even having the alpha variant COVID-19 vaccines, which are available worldwide, a person can still get the delta variant infection afterwards, despite being fully vaccinated. When we look at the symptom profile of these two diseases, the fever, which can be high, the body ache, the muscle aches, and the gastrointestinal symptoms like nausea, abdominal pain or stomach ache and diarrhea are common to both diseases. But when we look at the uniqueness of these diseases, we realize that the joint pains that are there in dengue are often not there in COVID-19, and there's loss of taste, the loss of smell, the sore throat, the cough, the shortness of breath, the low oxygen levels. Some of these features are not present clearly in dengue and can make the two diseases stand apart. We do know that both of them can potentially get very severe, and we know that COVID-19 can lead to multi-organ failure and can even cause deaths due to cytokine storms. Similarly, the dengue hemorrhagic fever or dengue shock can cause death amongst people. So when we look at the lab profile of these two diseases, they are fairly unique and can help differentiate them. The CBC, this complete blood count, which is a very simple test available all across our country, can be very useful because the dropping platelet counts, potentially the dropping white blood cell counts, are fairly unique to dengue. We can also see in COVID-19 something called reduction in lymphocytes, which are one of the type of white blood cells, and the neutrophil to lymphocyte ratio can get increased, which can be a sign of progressive or severe disease. We do need to realize that in both of these diseases, a normal CBC does not rule out the infection, and you need further evaluation. The specific test for dengue is something called an NS1 antigen and a dengue IgM antibody. Similarly, for COVID-19, we have the COVID RT-PCR, or we have the COVID rapid antigen test that can help in the diagnosis. Once the right diagnosis is made, the treatment for dengue most commonly is symptomatic care. So fever, treated with antipyretics, loss of hydration, treated by adequate hydration, supportive medical care, and in rare cases a person may need hospitalization and careful monitoring of their platelet counts and also further management as per their medical professionals. When it comes to COVID-19, we certainly have antipyretics as our first line of management of the fever and body pain, headache. If there are further symptoms, then we know that we have availability of oral steroids. There are antiviral agents like favipiravir, remdesivir. There are monoclonal antibodies that are available, and certainly there is a long slew of other therapies that are now presented for COVID-19. In all of this, we have to realize that early diagnosis is the key. So it is not expected that each individual should know which of these two infections they have, but seeking early medical care from your medical professional is very, very important, along with knowing what is going on around you. The season matters because dengue clearly increases in the monsoons, but there are year-round cases that are seen. COVID-19 has shown us that it does not follow seasons. And so friends, the more aware you are, the more knowledgeable you are, the more you can take the right decision for yourself, your family members, your friends, and take good care of yourself. So till the next time, stay safe, stay immune. God bless us all.